class with Steve. And Steve, how did you feel when you first came in?
Today?
Yes.
Not good.
Want to describe that a little bit?
Stomach hurt, my head hurt, and a lot of stomach distress. Didn't think I could lay here through the whole session. I kind of kept that to myself. I was trying to figure out how I was going to run out of here and have to go to the bathroom. It made it through the whole session. I feel like 100% now.
Very good. And how did you find ozone therapy?
Through the internet. Searching. There's one site to another.
And what are some of your goals with ozone therapy?
I think to feel better generally, just to take care of things that have been ailing me for my whole life or for years, that have been accumulative, that you don't really know why they're hurting you or harming you, and just to clear up a lot of stuff and to generally have better health.
And any specific medical conditions that you're using ozone to address, or?
I had Lyme disease in the past. That was something that I think has always stuck with me. I've had, I think, different, I don't know, I can't think of any at the moment that were specific.
And what do you like to do on your day off?
I like to ride my bicycle.
How far?
As far as I can. It's
What do
50,
you
100
usually-
miles.
Yeah, you log in a lot of mileage.
I feel like I don't log enough.
Well, I think you do it well. And what's the secret weapon that some of the pro athletes use?
You know,
Ozone therapy.
Ozone therapy.
Yeah.
This is a good legal way to keep myself fresh and fit.
Okay, so our last patient, Steve, what this does is ozone sequesters pathogens and cholesterol, fat in the blood, so it doesn't go back. And so this is what was left in his egg. It's like a continent of biofilm. Okay, I don't know if the viewers can see this, but there's fat and an aggregate of biofilm in the egg. This is from our last patient, Steve, who's being treated for post-Lyme and just to improve his athletic abilities. And this does not go back into the patient, so that's one of the reasons why this is a clear and effective treatment for cardiovascular disease. Or why are you here for ozone therapy? What are you being treated for?
Oh, plethora. I guess Epstein-Barr, anxiety, the blood pressure, my intestinal issues, and our family's got a history of heart disease, so we want to nip that in the bud and address it, yes.
Okay, get on it. And so in Faith's case, what we're going to be doing is we're doing not only the 10-pass MA, major autohemotherapy, but I will be adding in specific medicines for her case and symptoms from Germany. And that allows us to individualize treatment, and that's why our treatment is successful with people. And that we can reverse Epstein-Barr and chronic infections, and we can show that through as evidenced by labs. Usually patients do a series of 10, and then we can recheck. It doesn't even have to be 10 sessions, but we can recheck and see that the baseline, and then after treatment that changes.
Because I have anxiety, so she gives me an oral cocktail to drink, and it just calms me right down, slows my heart that's racing, and puts me in a much better place. And it works immediately.
You didn't feel miraculously better right away, but then you woke up and your email said.
Oh, yes.
So tell Winter that story.
After the first treatment, I didn't feel that good. As a matter of fact, I felt terrible. And then the next day, as the day started to progress, I started feeling more and more normal, and then I really felt good. So it wasn't right away. I was thrilled.
And also your bowels have been responding differently too. What's
Yes.
happening? You want to describe a little bit about what's going on with that?
Well, when I first came, I rarely had a solid bowel movement. So now that I say my stomach is fixed, I'm having nice, like normal people, solid bowel movements, and I'm not running to the bathroom every 5 seconds because I have the diarrhea.
And also, when you had your first session, then you did go to urinate and you said it It was, remember?
The stench was horrendous. So much so that when my husband went in the bathroom after me, he came out and said, "What the heck?" It was bad. I must have been getting rid of something really nasty.
So I think the detoxification process is beginning very, almost immediately for you.
It was immediate. I got
Yeah.
off of the table and went to the ladies' room.
Yeah.
And it was,
And then I'm gonna just inject this, but please tell the audience about your tooth,
oh,
and it was related to, and the tooth is related to the large intestines.
the large intestines, right. On the way home last time, well, I kept tasting blood in my mouth, and I didn't know what it was. And I opened my mouth and looked in the mirror, and one of my teeth were bleeding. And so I took my finger and just went to see how much blood was there, and a big glob of mucus or some kind of nasty thing came off on my finger from the tooth. So it bled for the rest of the night. Not horrible, but it was bleeding.
Mhm.
And the next morning I got up, everything was fine, the bleeding stopped, and
And this tooth has a history of giving you a problem.
yes,
Mhm.
yes.
So there was something there, possibly an infectious agent that
Mhm.
might have been in that mucoid glob
Right.
that you got, and that it was eliminated through your body. And that's the beauty of detoxification. If it's done well, the body is smart and it has an innate intelligence and it knows how to detoxify.
Yeah, it wasn't even something I was aware of at
Mm-hmm.
this point.
Okay.
Just a quick one, yes.
Yeah.
I'll make a joke of it.
Yeah.
Of when I got my last treatment, I came back and I said, yes, I had this alien feeling. It was actually a romantic feeling. I was not familiar with it. It had been dormant for so long.
What are people noticing about you?
My
since
skin. Everyone's saying how, oh my gosh, your skin just looks amazing. And my hairdresser, I went to get my hair done the other day, and she just looked at me and said, Faith, I've never seen your hair look so healthy. It looks amazing. New vitamins? What are you doing?
Did you tell her Ozone?
I did tell her, yes.
Okay.
Yeah, and she wants to come.
And she would be a good candidate
She would
because
be.
hairdressers are at high risk for certain kinds of lymphomas and other cancers because of their exposure to chemicals within their industry. You chose to come to this office and work with Dr. Enzenbacher and I. But where do you live far away? Do you have to travel
Long
to get
Island,
here?
yes, we do.
Long Island,
It's well
okay.
worth the trip, though.
Yeah, because we actually sometimes are working 7 days a week to help accommodate those who travel. That Faith is on a filling section of the cycle, so we wait for that to go up to the 200 milliliters, then we're going to ozonate it. But while that's filling, I'm going to be drawing up specific medicines for blood sugar regulation, antiviral to address the Epstein-Barr virus, anti-inflammatory ampules, hormone balancing, and improving cardiac function. So I'm going to be drawing those up and putting those in. All right. These are specialized medicines from Germany, and they come in an ampule. They are injectable, so we break off the top, and then we load that into the syringe. And this one is to increase energy for chronic fatigue syndrome. And then I can inject this directly into the egg, like so. So these medicines then become part of the mix of the blood and the ozone, which then is infused back to the patient. So there are some other ozone therapists in the city, a few around, but nobody does or has the equipment that we have. Also, they don't do high dose ozone. They do very low doses, and with our equipment, specialized equipment, we're able to get up to 2,000 milliliters of blood and ozonate that in one session, which takes somewhere roughly between an hour and a half and 2 hours.
For medicines you put in, I feel like I can breathe. Something just totally relaxed.